Doctors at Spectrum Health have seen a rising number of serious stroke cases over the last several weeks, leading them to believe that there may be a connection between COVID-19 and stroke. And Dr. Justin Singer, Director of Vascular Neurosurgery at Spectrum Health, joins us now to explain. What exactly are you seeing, Dr. Singer?
Yeah, so thanks for having me once again. Stroke is been playing out pretty interesting with COVID around the world presently. In about the last month, we've seen a 3- to 4-fold increase in the number of emergent stroke procedures that we're performing for patients. And during these procedures, we find patients who have stroke symptoms that come to the hospital and have a large blocked artery in their brain, and we put a catheter in an artery in their leg or in their arm, and we're able to unclog the artery. Now, we do have some seasonal variation from time to time, but it is pretty unusual for us to, let's say, perform 6 of these procedures in a 3-week time frame from last year and do 18 in the same time interval this year. So not all of these patients are testing COVID positive, although we have had some test COVID positive. So I think there are a few different things here at play. One of which is some patients are a little bit anxious to come to the hospital under the circumstances. They delay some small symptoms that they might be having a problem, and then they come a little bit late when things are worse. And on the other side of it, I think there is a relationship between COVID creating a state where the body is more likely to form blood clots, and we're seeing some manifestations of that in these patients coming in with strokes.
Mm-hmm. So we're seeing that here and at Spectrum Health. Is this a trend that is happening nationwide?
Yeah, I think in some of the larger metropolitan areas within the United States, they are seeing something quite similar. In one of the hospitals in New York City, they've been writing quite a bit, and I've had some dialogue directly with some of the providers there, where they've had a 5-fold increase in their number of cases. And what's interesting in their patient population, they're seeing patients who are otherwise mildly symptomatic from COVID, who are quite young, presenting with these strokes or a large blocked artery in their brain. So that's something that we're definitely have our eyes out for, and we're prepared to take care of here as the largest stroke center in Michigan and the largest comprehensive stroke center in the state as well. We actually perform the most emergency procedures for stroke in the state presently, and I think that's something that we're very able to take care of, and our eyes are ready and our ears are ready to listen for patients and take care of them when necessary.
Dr. Singer, could there be other explanations for the increase in serious stroke cases?
I think a big element is definitely that patients are a little bit scared to come to the hospital under the circumstances because they're scared that they might become sick with COVID there. And it's super important for people to realize that the hospital is prepared to take care of everybody. All employees who are in the hospital are screened on a daily basis to make sure that we're symptom-free and not having any fevers. Everyone in the hospital is making masks and wearing masks, rather. And the hospital is repeatedly cleaned and disinfected to make it a safe environment for everybody. And of course, we separate the COVID patients from the non-COVID patients, and we have a great testing capacity here to rule in and rule out those that we might be concerned about.
What is your best advice for anyone who thinks they might be experiencing a stroke?
Well, certainly for stroke, we always like to say time is brain. For every minute delayed in reopening a blood vessel from a stroke, you lose 2 million blood cells. So that's the longer that goes on for, that's more blood cells at risk. So seeking medical attention is very, very important. And it's very time sensitive, because if you don't get here soon enough, then we're lack an ability to be able to reopen the artery, restore blood flow, which could leave somebody with permanent neurologic injuries that we're not able to undo.
Mm-hmm. Of course, the focus in this interview is stroke, but anyone with a serious health injury or case should not delay, should act quickly, correct?
Absolutely, absolutely. And we're seeing people who have chest pain come in a delayed fashion, and we're seeing some unusual delayed presentations of patients who have had heart attacks within recent few days or weeks. We've seen the same thing with strokes, and we're seeing it with gastrointestinal pain. I mean, the bottom line is we're ready and able to take care of everybody. We have a great capacity to take care of many patients, and we've really scaled and evolved the health system in a very short period of time to do that. So don't delay care. We're here for you, and we can take care of everybody.
I would have to think if you have a question, it is smart to be better safe than sorry. And you had mentioned it too. There have been a lot of advancements in telehealth and other options for people if they're interested in having those questions answered.
Absolutely. There's definitely ways that you can interact with a healthcare team at Spectrum, whether it be regarding COVID or non-COVID matters. And it's always better to err on the side of caution. Don't be scared of us. We're here to take care of everybody, and we want to just prevent people from having these irreversible neurologic injuries or heart injuries or medical problems. And if you delay care, it just may mean that it's a bigger problem to fix in the end. So oftentimes, if we find things early, we have a better capacity to resolve them in a more simplistic way. If they get too far down the road and become more complicated, that's a little bit tougher for everybody.
All right. Thank you for taking the time to join us.
Thank you so much for having me.
Dr. Justin Singer of Spectrum Health.